Thank you all for joining us. Just to let you know, we'll start the presentation in about 1 minute. Hello, thank you once again for joining us. Just to let you know, we'll start the presentation in about 30 seconds. Unofficial hello, everyone, and welcome to today's Safety and Health Magazine webcast, Safety Masterclass, addressing the top concerns in safety programs, sponsored by KPA. This is Alan Ferguson, Associate Editor at Safety and Health Magazine and co-host of the On the Safe Side podcast, and I'm moderating today's event. Thank you once again for joining us. And before we get started, there are a few housekeeping items. As a disclaimer, the views of today's speaker and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise product or publication does not mean the council of the magazine endorses those items. After today's presentation, we'll conduct a question and answer session with our speaker. If you have a question, click the Q&A button at the bottom of your screen, type your question, and press the send button. We welcome your questions at any time during today's event. You don't have to wait for the Q&A to begin. We might not get to every question, but the good news is unanswered questions will be forwarded to today's sponsor. Also, after this presentation, you'll be asked to complete a brief evaluation survey, and I'll tell you more about that a little bit later. Just to let you know, this webcast will be archived so you can access it after today's live event. To view this webcast and all of our past webcasts, please visit safetyandhealthmagazine.com/events, or you may also receive a link in our post-event email. With that, let's introduce our speaker. With us today is Zach Pacello. Zach is an EHS compliance manager at KPA. He started with the organization in 2006, where his focus has been guiding other organizations to build positive safety cultures. In his current role, Zach also researches and interprets existing and new regulations related to general industry. In 2022, Zach was recognized as the Hazardous Materials Professional of the Year by the Alliance of Hazardous Materials Professionals. He was also selected by the National Safety Council as a Rising Star that same year. Again, we thank you all for tuning in this presentation. Zach, whenever you're ready, go ahead and take it away.
Thank you very much, Alan. And I first like to say thank you for everybody that's attending this presentation. And thank you to Safety and Health News Magazine for helping with production and the opportunity here to speak with everybody today. So welcome, everybody. As Alan mentioned, my name is Zach Pacello. You can see my accolades that he just went through on the screen there. I'm not going to spend a whole lot of time there. So I'm going to get right into the agenda today. If you've ever been on a webinar with me, you probably know that I take up the entire amount of time usually. So I want to make sure I try to get through as much content as possible to give everybody a little bit of a chance to ask some questions and some Q&A at the end. So I'm going to try to roll right into the content. Safety Masterclass. We're talking about the top safety challenges out there, top safety concerns for the safety professional. You're out there in the field, you're trying to implement a safety program with your employees, the organization, the C-suite, all of that combined, and you're probably experiencing some challenges. You probably have walked into a meeting room and thought, I have a vision for this safety program, and I'm going to go ahead and lay it out on the table. And after that meeting, you probably walked out and were like, what happened there? My vision is not exactly going to plan of how I had it going. And that's just the reality of today's organizational structure that's out there. We have common competing priorities that are out there that we have to actually try to interject ourselves in to make sure that safety is always going to be a top priority. So today I want to talk about really the value of an effective safety program. And that's going to be, most of us probably attending this webinar understand the value of an effective safety program, but let's talk a little bit about maybe some tangible dollars that you can actually throw to your C-suite in order to gain a little bit of top momentum as well too. Then we're going to jump right into those common challenges. And I've tried to narrow down all the challenges into about 6 different kind of overarching themes that are out there. We're going to talk about each of those 6. I'll try to give you some examples of those 6 and then some ways to actually overcome those challenges. We're going to talk about maximizing some of your safety resources that you have, because we're talking about resource constraint is going to be a common theme. And then some of the true costs and prevention strategies as well too. When I say true cost, there I'm talking about the costs that are associated with your safety program, not dollars and cents, not injuries, not indirect costs, not direct costs, but what are some of the challenges out there that are actually costing your ability to implement an effective safety program? Some of those things where an employee throws out an excuse and a reason for not jumping on board with some of the initiatives that you are trying to put into place. So after all that is said and done, we will get into some Q&A as well too. So the value of effective safety programs, like I said before, these shouldn't be any surprise to everybody. We're trying to protect people, we're preventing costs, promoting excellence. So lives and well-being, of course, that's probably why we got into the field that we are in today, is to make sure that maybe something has happened to you in the past, you don't want that to happen to somebody else. Maybe you were thrown into the safety role. Maybe you did not sign up for that activity. However, now it is a part of your job duties somehow, some way throughout the process as well too. So we want to make sure that we are protecting lives. We want to ensure compliance with laws and standards, drive operational excellence. Those are a lot of buzz terms, buzzwords. We have some statistics out there that if we invest in safety, we see a $4 to $6 return. That's from OSHA. 2.8 million non-fatal workplace injuries and illnesses reported from BLS back in 2022. And then organizations with a strong safety culture, I love that term, safety culture. It's such a buzz term anymore. Have 48% fewer safety incidences as well too from the National Safety Council. So great statistics, but really what drives some of those different things that are out there? So the benefits, we're looking at reduced incident rates and insurance premiums. These are some of the benefits that are a little bit more receptive by your C-suite that is out there. So reduced incident rates, insurance premiums, the cost. We're trying to get the direct cost down as much as possible. Enhanced employee morale and retention as well. If you have a safe working environment, you're going to be able to keep the people in place that you need to keep in place. And let's face it, the job market out there is a tough one. Trying to get the right people in the right role is such a challenge for a lot of different organizations out there today. Increased productivity and quality output. We have a strong safety program that should actually flow over into our production initiatives as well too. In fact, a lot of different companies will actually take what they've done with their safety program and their processes and implement them into that productive strategy as well too. And then of course, better public and stakeholder perception as well. So really what we're doing is we're trying to, and I'm going to throw that buzz term out there, develop a safety culture. I've never liked the term safety culture. Every organization has a culture. Safety should be a part of that. And there is a little bit of a study that I've done in the past based off of a cultural ladder out there that was put into place by a couple of professors. That would be Professor Hudson and Professor Diane Parker. Sorry, had to look up the name there for a second. And so they put together a effective safety program cultural ladder that is out there. So what am I talking about? Every organization has a culture that they go through each one of these phases typically in order to get to that generative status at the end. And it is a ladder. You're usually going through each one of these phases one by one. The pathological step, the reactive step, the calculative step, proactive, and then generative. And let's talk about what each one of these means. So as you're going through the pathological side, really that's who cares as long as we're not caught type of belief. Accidents are caused by stupidity, inattention, willfulness on the part of the employees. And so you're getting a message that's sent to the employees that, we really don't care about safety whatsoever. We're just going to kind of try to see if we can skate by. We're going to be complacent in what we do. You may be at that step right now because you're starting off new with the safety program. You may think to yourself, oh, we do have some initiatives, but we're really not putting anything into place. And we still have this pathological culture going on as well right now. Once you get past the pathological side, you realize where you're at. Okay, we need to put something into place and have regular safety meetings. But, you know, I don't know that we're really there yet. So maybe there's a lax, but all of a sudden an accident happens. And now, oh, wait a minute. Safety needs to be a priority. We had a forklift accident and somebody got severely injured on that accident. And now we have to actually really put in a good forklift safety program. And you're going completely 100% in that direction. You get it done. And then all of a sudden it's like, well, we got the forklift initiative done. All right, back to what we always do. And that's in the reactive phase, meaning that we're going to take a look at our lagging indicators, our incidence rates, and all of that. And we're just going to react to those. We're not really going to actually go and be proactive out there. So you may be in that phase as well too. Companies that can move on from that phase go into the calculative phase, and that is we are putting programs into place and they're going to be continual programs. We're going to start doing safety audits. We're going to start making sure we have, the right training in place for our employees as well too. So we're running the risk of going through the motions of safety management, but we don't fully commit to that area. So calculative is we have the systems in place to manage all the hazards. However, we're still not really getting down to those root causes. We're not really going out there and initiating what we need to actually identify where the real problem lies at. We're almost just putting a band-aid over the problem continually at this phase. In the proactive phase, that's where safety leadership and values start to drive continuous improvement. And really, it's ran by the management team at this point. So, top level management's making the decisions to really drive safety. We're making the processes and the systems that are now operational truly effective, but the employees haven't completely taken hold of it. So, management actually has in place what needs to happen by we're going to do audits on every Tuesday, first Tuesday of the month. We're going to sit down. We're going to have a safety committee meeting to talk about those items. You guys are all going to take training on, forklift, lockout, tagout, you know, hot works as well too. So management's really driving it. You know, still you have employees out there that aren't really turning in incident like near miss reports or anything like that. So when you get into the generative stage, that's where you really get that employee engagement. And now management just has to make the direction of the safety program go, but the employees are really running the show at this point. The employees are actually deciding what's the best audit schedule, what is the best way to go about abating some of these identified hazards out there. We've recognized in some trends recently that we have a dangerous situation going on in the shipping department with the forklift management. And therefore, we need to schedule some more time for some forklift practice. Even though we've got everybody through the training, it's still dangerous. People aren't doing what they're doing, and therefore we're requesting that more emphasis be put on the forklift training. When you get the employees built into that, that's when you're in that generative process. And that's where your culture now has, you can almost throw out there that term safety culture at that point, which is what everybody seems to be striving for. So let's take a look at maybe you're in that pathological phase, that reactive phase as well too. How do I get management to really buy into what we need to do to invest, to make sure that we have the right processes to avoid inconsistencies? And so what you want to do is actually come up with a good example to show them of a scenario of what if this were to happen. Go back in your past and take a look at some near miss incidences. Take a look at maybe some actual real cases and take a look at the numbers associated with that and then state to yourself, okay, it was a near miss, but what if this actually did happen this way, where we actually had a serious incident, a tragedy, unfortunately? Let's put some numbers to that and really showcase, yes, this near miss happened here. And if we don't address this, it's going to continue to happen. And here's the potential loss that you're going to have. So here's an example of something like that. And this is all made up in my own head at this point. So, any relations to any popular space movies or anything like that? Completely coincidental. So the Bantha Blue Milk Company has a powered industrial truck on site. Facility doesn't have any type of powered industrial truck program, no policies, no training, anything like that in place. So one day, part needs to be delivered to a certain department. New untrained employee jumps on the forklift and they try to deliver the part. They're not wearing their seatbelt. They didn't do any type of pre-trip inspection, anything with that. Then they notice the brakes are a little bit faulty on this forklift. So as the employee begins to enter the service department at a high speed, they see another forklift backing up, and therefore they got to swerve to avoid that collision. Brakes haven't been functioning properly, and the forklift slides a little bit, starts to tip. And this is probably where you're at that phase of we've had near misses of forklifts sliding, but nothing's ever tipped over. Well, take it a step further in your own mind. And what if that forklift tipped over? What's the worst case scenario? So forklift tips over, employee jumps for it, employee's leg gets pinned between the ground and the cage that surrounds the driver's seat. The employee is taken to the hospital. Unfortunately, the leg needed to be amputated. The part slid off the forks, knocked into a 55-gallon drum of oil, some hydraulic oil, and it spills off the loading dock and then goes into a nearby storm drain. So lots going on here. We see red flag after red flag after red flag at this point. But this is where you can start to put some numbers to this to really show your C-suite why you need an effective safety program. And so we go right into some of the direct cost. And you're ever wondering where you can get some of this information? OSHA has a safety pays estimator out there. It's actually a great tool where they can actually estimate the dollar amount in direct cost and indirect cost for an injury that were to happen. So if I go in and I put in an amputation, a concussion maybe from the forklift incident, a fracture, the direct costs they're estimating, as you can see right here on the screen, $96,000, $54,000, $54,000. Indirect costs, which once again, that's an estimate. Indirect costs we can never really get official numbers on because we're talking about, backfilling positions, the decrease in production, all those intangibles that go into effect. You can see here $105,000 on an amputation, 60 and 60 on the fracture. So we can apply some actual medical cost here, but that's not it. We have a potential OSHA citation. So remember, this was an amputation. That has to be reported to OSHA within 24 hours of occurring. And therefore, now we have all of a sudden an OSHA inspection going on. And during that inspection, the officer does some interviews and they kind of go through the forklift program and they find out we've got issues with the forklift program. We don't have the correct training in place. We don't have, the proper inspections going on. Or we take a look at maybe some previous inspections and there was a note on there that the brakes were bad on the forklift. And so we put that into place. That could be considered a willful violation. A willful violation, as you see here, really jumps up that price at that point on that actual monetary citation. So we're looking at proposed penalties here of over $130,000 there. Then we have the spilled drum of hydraulic fluid. Now, the EPA all of a sudden has to address this because that oil spill went into an area that was maybe in a retention pond or something like that because this happened in the parking lot. And so some past digging that I've done, we've seen facilities pay upwards of, $17,000, $18,000 for violations of not having spill plans. And then there's the cleanup effort on top of that. But we're just going to take a look at maybe not having the spill plan, a regulatory issue of about $15,000 on the actual pollution costs. And then you got your legal fees that go on top of it as well. Why am I saying legal fees? Wait a minute, we haven't been sued yet. Well, there was an amputation that did happen. And at that point, attorneys are probably going to get into contact with that person or vice versa. And that attorney is going to quickly try to build a case. They're going to ask for the OSHA citation or inspection report, and that will actually build the majority of their case for that attorney. If there was no training, there were no policies, no disciplinary action in the past, no inspections, no maintenance, all these citations mount up to negligence on the company, not the employee. And therefore, we're looking at what could be a $350,000 settlement, maybe even more out of an amputation. So if we total all of this up, we get into the total direct loss estimate of about 205,000, indirect cost 105, legal settlements, EPA issues, OSHA citations, the total $824,000 from a forklift mishap. And like I said, maybe this hasn't actually happened at your facility that you can apply these dollar amounts to, but take an incident, a near miss in the past, and think, what's the worst that could have happened here? All right, now I can go do some research on the World Wide Web to put some numbers to this based off some previous cases. And now I can build a case to show here's what we could actually cost savings here of a worst case incident that happened because of a near miss. We were able to see, okay, this could be the actual worst case scenario. Here's what it could have cost us. So I always understand that getting a top level buy-in is one of the top challenges when it comes to having an effective safety program. And this is one way that you can help get that buy-in, is showing the dollar amounts of how much could be saved. Now, what are some of the other safety challenges out there for our safety professionals? And this is where we're going to jump into the 6 kind of siloed areas that I've created based off of my own experience from the past. So there's not really much numbers that go along with this. This is basically, you know, the top concerns that I hear from safety professionals, from employees, from my own experience as well too, in trying to actually get programs up and running as a consultant. And so resources, that's going to be your constraints, your competing priorities, knowledge, and that's keeping up with the different regulatory changes that are going on, especially with the administration we have going on right now with deregulation and, you know, contributes, you know, the focus on big business as well too. It's kind of difficult to keep up with what's going on. Inconsistency across multiple different sites or multiple different departments within your own organization, I see as a top challenge. Communication between departments, between different levels of management, and between sites. If you are supervising or managing several different sites that are out there, it's kind of hard to keep all of that one consistent and also get the communication out to the proper channels out there as well too. Engagement, and this I feel like is always a big struggle. Getting the employees to buy in what you're doing so you can get to that generative status on that safety cultural ladder. That is one of the ultimate goals there. How do we get the employees to actually do what we're asking them to do willingly without having to remind them to do it constantly? And then effectiveness of your data. So a lot of safety professionals are starting to collect more and more data, and we're starting to drive that data on different dashboards. But what do we do with that data? You have to have a goal to go with that. So let's take a look at each one of these and break them down a little bit more. So when it comes to resources, the constraints on the resources, we're talking about like a limited budget. And I have an example for each one of these I'm going to try to go through. So limited budget. A small construction company wants to purchase fall protection harnesses for their employees, but they delay the investment due to the budget constraints, and instead they share a limited number of harnesses, causing delays and unsafe workarounds. Uh, Insufficient staffing. The only safety manager at a regional distribution center is responsible for environment and compliance and facility security. With limited support, site audits are infrequent and incident investigations are rushed as well too. Competing priorities. During peak production season, leadership shifts all attention to fulfilling customer orders. Safety initiatives like job hazardous analysis and refresher training are postponed indefinitely because we can't afford the downtime. Lack of safety equipment or technology. Dealership service bay has no battery disconnect tool for hybrid vehicle maintenance. Employees use improvised methods, increased risk due to lack of proper equipment. And then time limitations. New employees are busy at a shop and only receive 15 minutes of safety overview during onboarding. There's no really consistent training that's going on out there. And by the way, I need to go back here. I think I forgot to actually a poll question here. So my apologies here. Let's go ahead and throw up a poll question on this slide. And I kind of wonder, and I think it was kind of good to go into the little bit of those at first, but what is your biggest safety challenge in maintaining an effective safety program out of these choices that are out here? I believe I have all 6 of them here in the poll question. So we'll take a moment here for everybody to put in an answer there. But I'm just kind of curious with the audience. What do you find to be your biggest challenge out of these 6 that I've kind of grouped together? So hopefully everybody's had a moment to answer. If we wouldn't mind seeing some of the answers that are out there. So yeah, low employee engagement took the top right there. So at 35%, followed up by inconsistency across the organization at 28%. Then it looks like we are jumping to communication gaps, lack of resources, and then regulatory complexity and data without action. So we're kind of, nobody kind of ran away with, none of these categories really ran away with it. So we're all having some form of this challenge is going on out there for most people. And maybe that was a hard decision to determine which of these was going to actually be your biggest challenge that's out there. You may have all 6 of these as a big challenge out there. So let's continue on here. And so if we go back to the resources, let's take a look at maybe how do we go about correcting some of those challenges. So risk-based prioritization strategies. This is where you need to actually go back into what you are trying to do and reprioritize yourself and come up with maybe a top 3. Start small, baby steps. Maybe we need to focus on a certain initiative such as hazard communication because we have chemical issues going on. Maybe we have to take a look at other items such as the forklift safety program as well too, and going into channeling like where are we going to actually have practice time for the actual operator's performance evaluation that needs to happen. So you can actually break it down and prioritize your strategies for where we actually need to base our resources. So we're not, pulling money all over the place. We're going to influx it into these 3 items, and that's where you can present that to the C-suite. Technology is going to help you out as well too for some of your challenges that's out there. And you're going to see some common themes throughout all six of these. You're probably going to see resources kind of be the common theme. You're going to see money and budget prioritization. You're going to see technology come up over and over again. You're going to see lagging and leading indicators as well too. So technology can be very useful when it comes to the resources. There are several different mobile apps out there when it comes to help promote safety. Uh, Take a look at a lot of the NIOSH apps. In fact, I found one very beneficial. If you have a construction company, I would highly recommend this. It's the NIOSH Ladder Safety app. And what it does is I use this all the time at home. When you prop up a ladder and you're going to climb up to a second level, that ladder has to be at a certain angle for it to be actually safe. You don't want it to be too steep, too shallow. And therefore, there's a measuring tool that you can actually have on your phone, and it'll like flag green when it gets at the right angle when you hold it up to the ladder. It's a pretty cool little tool. So take a look for different safety technology solutions out there that may be helpful in the field that you can actually push out to your employees to try to encourage them to use. Leading and lagging indicators. You know, if you're focused too much on the lagging indicator side, we need to go into the leading indicator side. Lagging indicators, stuff that's already happened. We're in that reactive mode. We need to go into the proactive mode and take a look at the leading indicators at this point. And I've got more examples about leading indicators coming up later. And then cross-functional collaboration approaches. So when it came to that time issue with maybe new employees and being able to train, that's where you go into a different department such as human resources. If you're not collaborating as a safety professional with a human resources department, you need to make that relationship immediately because human resources has to do all kinds of onboarding for new employees. And that's where you can really build in your safety training and your whole initiation and welcoming onto the safety program right out of the get-go. Knowledge is the next category. And so we're talking about each one of these as we break it down. So culture versus compliance versus complacency. And that's where you understand your own organization. Where are you at on that cultural ladder? Are you on that complacent side where you're at more of a reactive phase? Are you just on the compliance side where maybe you're more in the calculative phase? Or maybe you actually do have proactiveness going on and you're at that culture phase. So find out where you're at on that cultural ladder and then determine what you need to do to take the next step on those rungs. Relying on what's always worked in the past as well too. So we don't want to do that. You don't want to have a binder out there of safety data sheets that are haven't really been looked at in the last 20 years. And it's like, well, it's always worked for us in the past. It's got us do a regulatory inspection. Well, the purpose of that SDS binder is to actually be there and available for an emergency does happen. And you can't predict when that's going to happen. So you can't always rely on what's worked in the past. State of constant change. We want to make sure that all the time with regulations, we got to keep up with what's going on out there. Greenhouse gas initiatives are a big conversation piece that's going on right now. If you're in the state of California and you have a lot of revenue, or if you operate in the state of California, you may want to look into their new greenhouse gas reporting requirements, especially if you do over $1 billion of revenue, but you operate in California. There's some new regulations on that reporting that are coming out. So it's something that you constantly have to keep up with. Translating regulations into practical workplace procedures as well too. So how does this apply to us as a new regulation comes out? Number one, to determine the applicability. And then after that, okay, break that down into what do we need to do? The overwhelming scope of responsibility. You can't be a safety manager, the security manager, the environmental manager, handle the phone system as well too, the new technology distribution as well too. A lot of times safety professionals kind of get categorized into, well, just, you know, they're just a safety person. They don't have a whole lot to do. So give them this task as well too. No, we got to be clearly defined in what we do with the scope of our responsibility. And then we have to avoid common regulatory misinterpretations where you just assume, like, well, that really doesn't apply to us in this situation. We want to make sure that, yes, we're being compliant, but I think there's a gray area or a loophole there. That's not why the reason why that interpretation was actually created. It was created because something's happened to somebody in the past, and therefore we have to get away from that type of a mentality. So keep up to date with everything that's going on out there. Subscribe to targeted feeds. Set Google alerts to help you maintain knowledge base of what's going on, not only with just in the news and the media, but also the regulatory activity that's going on out there. Rely on interpretation letters and make use of consulting as well too. Bounce ideas off of somebody that's a third party outside of your organization that knows safety. With the EHS manager, usually is on an island. They're kind of off by themselves and they can't really discuss all that they want to discuss all the time because a lot of people don't have that same knowledge base. So surround yourself somehow, some way outside of the organization with that knowledge base. Make a regulator friend. They are people too. They're not robots. So make a regulator friend that you can actually bounce ideas off of when it comes to interpretations. Join professional organizations. There's several different organizations that are out there. You've got, organizations that band together for, different credentials like your CSPs, your CHMMs. You have also like your ASSPs that are out there. Take a look at joining those organizations so you can have a common community where you can ask those questions. Define your own role with a clear scope of work as much as you can as well. We don't want to get burdened with way too much different activity going on for what we're trying to do as safety professionals. So make sure that you actually understand what it is and you can deflect those extra tasks that get given your way and conduct gap analysis as well. And this is where we get back into, understanding where you're at. Where are we at on that cultural ladder? And what do we need to do? Where do we want to go? What do we need to do to get there? The next phase is inconsistency. So when it comes to inconsistency, we've got excessive paperwork. So, examples would be like supervisors spending like hours filling out overlapping inspection forms or safety checklists or sign-in sheets. And so as a result of that, you got your safety champions doing that, maybe just employees, you're going to have items that are going to get skipped or something that's going to get rushed and creating, inconsistencies. Uh, Formats across all departments. If you got one site using a digital form for incident reports, another uses Excel, a third relies on like handwritten notes, that standardization is going to make it confusing for everybody out there. You need to have your whole organization on one path, one consistent type of platform. The documentation isn't accessible when it's readily needed. Think about it. How easy is it for you to right now get the last 5 years of your OSHA 300 logs together? Can you be able to actually produce those in a reasonable amount of time? Or are they offsite somewhere else that's in control of like the human resources manager? And, maybe they're out that day and all of a sudden it's like, oh, we can't even get to that documentation today. That's the type of documentation that's going to be asked for during a regulatory inspection first. And therefore, you want to make sure that this stuff is all easily accessible. We're doing records that are meeting the compliance, but we're not driving improvement. If a company maintains all the required training rosters and their incident logs at the regulatory minimums, but we don't review that, we don't look for trends, we're not going to drive any kind of improvement at that point. We don't know what our challenges are. The outdated procedures, lockout tagout. Let's say you got a lockout tagout policy that still references equipment that's been decommissioned and not even in place years ago, and it doesn't reflect some of the new technology that's in place. And new technology is coming into place more and more and more. You have new power sources, especially battery power sources with lithium ion batteries. A lot of people switching over to that type of technology these days. It does your lockout tagout procedures address those. And then insufficient evidence of training comprehension. This is what you're teaching to your employees getting down to that level of comprehension where they can retain it. So maybe you're having employees sign off on a training after watching a video, no quiz, no evaluation, no discussions, and then later that one of those employees makes a critical mistake. They misunderstood it. We pencil whip that, and we've got to avoid pencil whipping as much as possible. So some strategies that you can use to try to overcome those challenges, implement an electronic document management system that your whole organization has access to. There's SharePoint capabilities that are out there through Microsoft tools, all kinds of different document management systems that are out there. We're at a day where we need to have this information at the palm of our hands. And we have that capability with the mobile equipment that's out there, tablets and phones. So why not have those readily, easily accessible? Create standardization for clarity. We have different people that should have different levels of user access and different roles and to be able to create different forms, but we don't want to overpopulate and oversaturate that area. So make sure you have clearly defined user roles out there for who's going to do what in that document management system. Make sure you have a regular cadence for version control. Like on that lockout tagout example, we have updated technology. We haven't looked at that in 10 years. Therefore, we need to make sure they will uh, always have updated version control so we have a schedule to review these procedures. Use visual elements to help with the training as well. Photos, diagrams, flowcharts. Don't just talk to people. Use stories as much as you can. Incorporate QR code links. I think those are very important when it comes to technology these days. Use documentation reviews as training. And this is where you can implement the employees into the engagement discussion as well too, such as we know that this document really doesn't reflect our operations. How can we make things better? How can we improve this program? Bring those people in from those different shifts so that they see that they have an opportunity for feedback as well too. Communication. Whew. Communication breakdowns happen all the time. And it's one of the biggest challenges that I think is out there today because you have a vision in your head. You want to communicate that to people and you see it going visually down your path, but you cannot think of all the speed bumps. You cannot think of all the roadblocks that are going to be out there. And therefore, you need to actually work as a team to try to address those as much as possible. So, siloed data. Example would be like, a maintenance team tracks equipment failures and near misses in one system, while the safety team logs incidents in another. So neither team really sees the full picture of what's going on here because those two go hand in hand usually together. Delayed reporting. That we all have that. Supervisor forgets to submit an accident report. You as a safety professional gets out to the accident scene and you don't really have the data because it's been 4 days later after you receive that report coming in. You can't really do an effective investigation at that point. Lack of department accountability. So maybe HR assumes the safety team handles all the training. And so while the safety team assumes like department managers are ensuring the attendance. So as a result, the required annual forklift refresher training is missed for multiple employees because we don't have departmental accountability of those managers getting those people to the correct spots because they don't have the correct information. Feedback loops. Employees submit hazard reports through a form, but never receive acknowledgement, see any type of follow-up. And that is the epitome of, follow up, do what you're going to say you're going to do. Okay. Actually do what you say you're going to do. We've all heard that phrase before. So walk the walk, talk, talk the talk, walk the walk, I believe is how it goes. I may be messing that one up. But you actually have to actually put tangible visual results into action, or else you're not going to have that effective employee buy-in. And then the misaligned priorities, we all have those. Business, 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 production, production, production first. Well, wait a minute, don't forget about safety. Uh, yeah, just do the safety squint for me on this one. The safety glasses. We can't fall into those patterns. You have to actually take a stand, and maybe you go into at that point some stop work authority and really implement the effectiveness of that. So some of the solutions create shared dashboards, reporting platforms that show safety metrics company-wide, and along with those implementation, along with anonymous simplified reporting tools. Simplify it for people. And that's where those QR codes come into place, those mobile applications as well. Include safety responsibilities in job descriptions, not only for yourself, but also for the managers and the C-suite that are out there. Performance reviews. We need to hold people accountable as well. And so if they don't have that as part of their job responsibilities, it's easy to forget about those safety tasks that are out there. And then we have that communication breakdown. Add like what's working and what's not questions to safety meetings, which we just talked about. Reinforce a no blame culture, and we'll talk about that with effective employee engagement as well too. But we can't have, well, it's just stupidity, or that person, they're the person that always has issues happen, therefore we can't have any credibility to that. You can't look at it that way. You can't as a safety professional. It's always going to be an issue when it comes to the organization. Create a regular rhythm for check-ins after program rollouts, 30, 60, 90-day reviews. And so a lot of times we do these on employees as well too. We need to make sure that we do a 30, 60, 90-day follow-up to make sure, is our program being effective? And most of us probably understand the PDCA cycle, plan, do, check, act. 30, 60, 90, that's where we are, checking and acting. How effective is our program at this point? And if you don't have specifics in place, you're going to forget about that. And then you're not going to see any type of results from your program that you can actually share with the organization. Train department heads on how to deliver aligned safety messages during team meetings. So this is where you're developing your army at this point. You need to develop safety champions, and department heads have to be in that army as well too. They're almost like, your platoon leaders that are out there, and they have to be trained on these different safety messages as well. You can't just give them a message and say, "Hey, go read this," go cover this, little 2-page flyer in a toolbox talk, and that's it. You need to train them on actually what the message delivery should be. You need to incorporate stories. You may gain some stories by a sit down meeting on training them on what to deliver as well too. Give them an example story if they don't have one that they can share of consequences of what has happened during if that safety message is not followed. Standardized communication through scripts, templates, toolkits for supervisors as well. Okay, they have other jobs to do. They are not going to want to create this information. You're going to have to create it and give it to them. Engagement. So I always think this is the top one because what we're trying to do is get people to change behaviors. And that's one of the biggest challenges out there in life. Think about it. Have you ever had a bad habit that you've tried to break? You know, we have issues out there with different addictions that are out there. Same thing with habits. And therefore, when it comes to the organization, there's going to be behaviors that we see as a bad habit or an addiction, and we have to change that somehow, some way. And that can take years. But there are some different things that you can see out here from the challenges point if we break it down, such as the perception of safety as a cost center rather than a value add. So maybe the plant it delays investing in new machine guards because management believes it's not worth the expense. No injuries have occurred yet. We don't need to spend that money on that. That's going to reinforce that belief that safety is a financial burden rather than a long-term benefit, which you don't want that perception at all. Leadership focus on production metrics over safety performance. And you've seen that as a common theme here. Supervisors are routinely praising teams for meeting output quotas, even when it's clear that maybe they bypassed the proper lockout tag on sequence. We don't want to neglect that the company or the performance was actually tainted there because even though you got the job done, you did it without being safe. The employee resistance to additional procedures or requirements. Warehouse workers are required to fill out a new pre-shift inspection checklist. They look at it as just another redundant piece of paperwork we got to fill out. So they skip it or they rush through it. That's another challenge that we're going to have. We can't overburden them with too many different things that they have to do that's outside of their normal scope of work. Cultural barriers. And I think this is one of the huge ones, especially with the younger workforces out there. So you may have a culture that is a tough it out mentality. Rub some dirt on it. Get up off that floor. You slip on the floor, maybe due to an oil spill. Get up, you're fine. Get back to work. You don't need to report that. And then all of a sudden now we've missed something that leads into the employee all of a sudden having an issue, a medical issue come up 4 days later. And now it's become a lot worse because they didn't seek out the medical attention at first that they should have. Disconnect between management directives and frontline execution. Maybe corporate rolls out a new safety initiative requiring hearing protection, but the policy is not really written very well. We're not providing the right type of PPE. We're only doing earplugs where some people would benefit from, maybe the earphones instead. And then we got local supervisors not enforcing it. We got confusion. We got non-compliance, and therefore the employees are like, why am I bothering with this? And then safety is viewed as pretty much just the responsibility of the safety professional. And that's when you become the safety cop. And nobody wants to be viewed as the safety cop because now you look like you're a threat and nobody wants to talk with you. Nobody wants to engage with you at that point because they feel like, oh my gosh, there's, dad with the evil eye over me as I've got my hand in the cookie jar at this point. Therefore, we're going to basically avoid any type of conversation in the future. And now you're missing out on potential hazards as well, too, because the employees aren't sharing them. So you can see here some of the solutions demonstrate some financial impact of strong safety performance through concrete metrics. This is where you're going to have your data to push towards the goals that you're actually trying to get to. Connect safety outcomes to strategic business objectives and values, and that's getting on board with the C-suite so that we can actually put safety performance metrics in with the safety manager with the actual management plan. Involve operational leaders in the safety program development. Create safety champions at all levels. At all levels. So you need to have a safety champion in the C-suite. You need to have a safety champion at the complete low line, third shift employee level. We have to have a representation from every different shift, every different department out there. We need champions across the board to help push the initiatives that you're trying to push. Regular communication is imperative. Use storytelling and real examples. Provide ops for employee input and feedback and recognition. Recognize, recognize, recognize. Engagement will get better if you recognize employees. At my company now, we try to do our best with several different recognition and programs. The more you can tell an employee, thank you for doing what you're doing. Thank you for putting those safety glasses on. Thank you for wearing that forklift seatbelt. Thank you for closing the flammable cabinet doors like they should be, or reporting that, this item wasn't grounded or bonded like it should be. That goes a long way. And give that recognition to the actual supervisor of that employee as well, too, so that can be noted in employee performance reviews. And then include safety metrics at all levels. And the last one we'll take a look at here is data overload. You're collecting data, but are you using it effectively? And therefore, an over-reliance on lagging indicators. So maybe you're tracking only OSHA recordables and lost time incidences. There was no reportable injury last quarter, so leadership assumes everything is fine. We're going to ignore the mirror misses now going forward, and all of a sudden you have gaps start to develop. Difficulty attributing improvements directly to the safety program elements. So after launching maybe a new safety initiative, the incidence rates decline, but it coincided with a reduced production volume due to some kind of stoppage or something like that, or short order supply. So leadership is questioning, like, okay, your safety improvement, did it really have an impact on what is this, or is it mainly just due to low production? The inconsistent data collection methods. So you can't be in spreadsheets while others are using handwritten logs, while others are using mobile applications, others are using Microsoft tools. We have to be able to collect all of our data in one platform so you as the safety manager can analyze it all together and use tools to actually make those analysis much more easier for you. Challenges comparing performance across different operations or sites. So one site has a high forklift usage in reports, but the other one is focusing on office work because of maybe some ergonomics related issues. So we can't really compare their safety performance on the same KPI level, key performance indicator levels. It's going to skew in different directions because they have different directives going on out there. So we have to be on a consistent basis, as we described before. Metrics that don't drive the appropriate behavior. And this has kind of been an OSHA initiative in the past as well, too, when it comes to incentive programs. You can't really have an incentive program anymore. It's very much frowned upon as far as like if we go 0 days, or I'm sorry, if we go 90 days with 0 incidences, then we're going to reward you. Well, that drives behaviors of, oh, I got hurt, but it's day 89. I can't report that. It's going to like cost everybody else the gift card or the pizza party or whatever it may be. Use metrics that are going to drive the appropriate behaviors, such as we're going to measure how many people attended a toolbox talk over the next 30 days. That's driving appropriate behaviors because we're discussing safety at that point. And then the insufficient benchmarking. Safety manager maybe presents some quarterly results showing some low injury rates, but we don't know how that compares to other similar organizations. And therefore, like the leadership team doesn't really know how to actually view that data at that point. Are we doing better than others, or are we just kind of, going with the flow of the pack? So understand the true costs of the safety incidents, the direct and indirect costs, and how does that apply to your actual program? Can you put dollars and cents to the data that you're actually measuring out there? Use ROI calculation as well, too. Create specific measurable safety objectives tied to the business goals that are out there. So, and make them consistent across the entire organization. Use the data to visualize the tools to communicate the trends and patterns. So this is where you're going to be able to, support your charts and graphs and all of that over time, showing hopefully those numbers going in the right trending direction that you want to go with, so that all of a sudden, oh, wait a minute, this actually is working with the different process that we put into place here. And make sure to use both leading and lagging indicators. And I think there needs to be a bigger focus on leading indicators to promote good effectiveness of the behavioral change. So a quick poll question here that we're going to go ahead and pop up about leading and lagging indicators. So how often do you use leading indicators like training completion, observations, near miss reports to assess safety performance? So are you using them regularly, occasionally, rarely? Not even sure what leading indicators are. And yes, regularly means that you have a pretty consistent process in place over the occasionally side of it. Give a moment here for that. And we'll go ahead and pop up those results. So regularly got the majority there at 54%. That is great to see, and very proud of all of you for that. On the occasionally side, 24%, so we're making up the majority there. On the rarely side, we're at 21%, and not sure what leading indicators are. We have a 1% there. So I'm very happy to see that we are onto the leading indicator side of measurements. Lagging indicators, that's going to be the indicators that stuff that's kind of already happened that we don't really have a whole lot of control over at this point. But we can take a look at the history. So that's your TRIRs, your DART rates, your incident rates, your insurance cost, your experience modification rating that your insurance carrier gives to you based off of how many accidents you've had over the past 3 years or so, fines and citations. Leading indicators are proactive stuff. What are we trying to do to make sure that our lagging indicators don't continue to increase? So maybe it's training completion percentages, time taken to correct hazards, time taken to complete a drill, which I have as an example in here, survey results, uh, number of employees participating in toolbox talks, number of times that management has come down and had a safety talk with the employees. So as we move on to the next slide here, I believe I have another poll coming up, and I do. And so let's go ahead and put this poll up. Have you ever modified your safety program after identifying a trend from near misses or leading indicators? So yes, regularly we do so. Yes, occasionally, never, or we don't track near misses or leading indicators. And then while we have everybody answer, I'll just talk about this slide up on here. So this is an example of really going into kind of a leading indicator goal of collecting some data, understanding that you have an issue in a certain area, and really prioritizing into just a couple of different areas instead of trying to do everything all at once. So let's go ahead and take a look at the results of the poll question. And so, yes, rarely we do modify things after the leading indicators are tracked. Yes, occasionally at 55%, rarely is at 38%, never at 3%, and we don't track near misses or leading indicators at 5%. So the occasionally side does take majority on that. So hopefully we can get more into a regular process going on out there, and that's one of the goals that you want to set for yourself. So the example here on the screen, maybe you can use this if you want to, but we must adopt the safety training program. So create a risk assessment to determine like which courses you want to have as your safety training program focus on first. So let's actually use the sit down classroom style to ensure completion. The courses will be taught by a combination of line leads with experience and maybe some different consultants as well too. So set a SMART goal for this. You want to put in a safety training program. You can't do it all at one time. So let's just pick 4 courses to go with. We're gonna go with tool safety, eye injury prevention, forklift operator training, and lift safety. And we chose those 4 because that's where our lagging indicators showed that we had issues at. So now let's check the leading indicator here. We're going to measure these different 4. And so our goal is we'll achieve 90% safety training completion in 4 safety courses by March 1st. And we're saying this begins on January 1st. So then you start your progress and you go into your actual tracking at that point. And halfway through in February, you need to take an estimate and take a step back and how are you performing? And if you take a look at this data here, oh, we're doing great in tool safety, eye injury prevention, and lift safety, but oh man, we are not doing very well on the forklift operator side. All right, where are we missing the mark at? Why are we not progressing? Well, it requires a driver's practice test. And The forklift's not always available for practice, and we're not sure about the test administration because there's this practical evaluation as well too. So your solutions set up timeframes and obstacles in the area for forklift practice. Review forklift sit testing requirements with the supervisor teams. Just they understand there's a classroom version and operators test that must be done, and here's how you administer all of that. Make an online course to make it easier to repeat for those who missed the live event as well too. So we can always follow up with those people and get them through the course. So that's how you can actually take a look at your leading indicators to see where do we need to improve. Another quick example here. We're going to improve the time it takes to run a fire response drill by 50% with the 100% completion of the fire response checklist. So we put together this fire response checklist. We have to hit these 10 items during a drill. Okay. And it could be somebody dials 911, somebody pulls the fire alarm, somebody shuts off the electricity. I mean, there could be all different kinds of things within your checklist. So as you can see here over time, okay, why are we not improving to the 15-minute count goal? Well, accountability system is flawed. Head counts don't really provide complete info, so we are not sure that everybody got out of the facility. The alarm system is difficult to hear the production department. All right, these are things that we can actually address at this point to make ourselves more efficient. So, use the software to help check accountability, like a mark safe system. Work with the alarm company to establish a more effective alarm, maybe introduce some strobes, and maybe establish more of a mass communication systems for all employees. So we got to maximize the safety resources. Once again, some quick wins that we can discuss here. If you're thinking to yourself, all right, this is a lot of information, Zach, and I am in one of those challenging periods here, and I don't know where to go from here. Here's some, maybe some quick wins that you can take a look at. Identify and train at least one safety champion so you're not out there by yourself. Okay? You got to have a team. You got to start to build your army out there. Get them on board with what you're trying to do. Make sure that they understand. Work it into their job role in the description as well too. Incentivize them as much as you can. Digitize the inspection and training process as much as possible for efficiency. You want that communication, you want that data, you want that consistent platform. Make sure you have something that everybody can use across multiple sites and that can feed data back into your kind of source hub. And then reassess your priorities and allocate your resources to your top 3 risks or so. So you take a look at this example here. We had 3 back injuries, 2 minor chemical burns, and 1 near miss involving electrical equipment. We did an audit as well too. So we took a look at our lagging indicators. On our audit, though, we had incomplete lockout tagout procedures and some outdated SDSs. And I threw the M out there just to show that they are outdated because they're no longer MSDSs. Employee feedback. We got some requests for some better lifting tools and concerns over unmarked chemical bottles. So you can actually take a look at your risk matrix here, identify your top 3 areas, manual material handling, hazardous chemical handling, and proper energy control procedures. So what can we do to address those then? Well, on the manual material handling, the old source is monthly ergonomic posters, generic annual training. Well, we're going to invest in 2 new lifting devices for heavy parts. We're going to implement a hands-on like safe lifting toolbox talk. We're going to implement like the buddy system, or maybe over 75 pounds, you are not allowed to lift this by yourself. Assign a safety champion to monitor and coach lifting techniques as well too. The chemical side of it, the old source, printed HAZCOM binders, rarely updated. Let's digitize the SDS program, make them accessible in the palm of your hand with the phone, or with the QR code to actually get to the actual SDS system. Host refresher trainings on labeling, PPE selection. Assign 1 person per shift to visibly check all labels during the daily walkthrough to make sure that they all marked properly. And then lockout tagout, the old sources. Lockout tagout training was only done with the maintenance team. Well, we got to do more than that. We have affected employees that we have to train as well too. So train all employees. Provide new locking control devices as well too. There have been a lot of updates on lockout tagout. Install proximity warnings as well too. So maybe if an employee crosses a certain sensor, or if a guard is taken off, all of a sudden we have an alarm or the equipment automatically shuts down. You have to do more than just that, but that's something that can also help out. And use QR codes to post visual step-by-step walkthroughs to show how to de-energize, isolate, and verify that you have actually controlled the energy on that particular piece of equipment. So costs on your program, what you're trying to do, not actually like costs when it comes to dollars and cents, but these are costs where people give you these excuses back of why they can't do what you want them to do. So Gain your near miss reports. Well, somebody might say, well, these tend to be lacking in real results because it takes time to complete a report and no one was harmed. What's the point then? Or if you want to take a look at your audit scores where you can get cost data is, over time, that complacency and pencil whipping starts to get back into effect. Learn from your lagging indicators. Well, how often does history really repeat itself? And in small organizations tend to be difficult to notice. And then safety is everybody's responsibility. High production can make accountability take a back seat, unfortunately. So as you can see, some of the different tactics here that we can actually get into: simplify reporting, reframe the value as well too, and reward reporting. Recognize as much as possible in order to get your mirror miss reports back on track. The audit score is becoming unreliable. Rotate the auditors. You know, audit the auditors as well too. Try to gamify as well too. Make it a competition. Lagging indicators are not predictive. Shift towards leading indicators. And then second, safety second, third, or maybe fourth, accountability has to be there for all. No one is above the law. So at this point, I know I pretty much just hit the top of the hour here. I warned you all that I do take a lot of time, but hopefully maybe we have a time for maybe one or two questions at this point.
Yeah, thank you so much, Zach, for this insightful and fantastic presentation. Before we start the Q&A, we want to remind everyone of the evaluation survey we're asking you to complete. The survey will open in a different screen after this webinar, and your input is important because it does help us improve our future webcast. Yeah, just to get to some questions. First one, what advice do you have for the one-person safety teams? It's the old story of we only have so much mental bandwidth and we can't be in two places at once.
I think that's where you got to go back and show the effects of the one person safety team, such as, because take a look at your lagging indicators at this point. Where are your costs at there? Can you put some actual dollars and cents like we did in that one example that we had up there? And then show all the initiatives that you do want to put out there. You have to have basically the resources in order to do so. And therefore, you're going to have a little bit more resource allocation shifted to your department, but also make safety champions out of the employees as much as you can as well, too. This is where you can actually go to the management level. We need to actually change our performance review status, and we have to put in safety as a portion of that. And therefore, you're going to automatically get some champions based off of that as much as you can. And you have champions out there. There are people that have actually been a part of fire prevention crews in the past, that may have had military experience in the past, that have been on safety teams at different organizations. You need to harness that as much as you can. And some might voluntarily come over, but try to incentivize them as well too. Work with their manager. Can I get them for 2 hours a day, and we are going to pay them an extra, incentive on top of that just to help me be a safety champion for those extra 2 hours out of the day. You might get voluntary use out of it, but if you incentivize them, they're going to be so much more thankful, and you're going to get more productivity out of them.
Yeah, our next question, do you have any good resources to use for a gap analysis?
I've actually created a few myself. There, I mean, what you're doing, you can almost take a look at it from different standard metrics if you want to out there. There's the International Standard Organization, ISO. They put out there pretty much, your ISO certifications that are out there. They lay out a pretty good groundwork of everything that you should be hitting on. And I think it's ISO 45,001. I think it used to be 18,001. I think it's 45,001, which is safety program. And that's really going above and beyond the call of compliance. And that's what you want to do. So if you can take a look at that type of a framework and kind of work towards that, that's going to show you where maybe some of your gaps are at, such as leadership involvement. And it's not going to get down into the weeds. It's going to be like leadership involvement, how training effectiveness, show for me how your training is getting to the line level employees and actually they are comprehending what you've trained them on. You may discover that you have a gap there. Yes, we've showed them video after video. We've lectured them, but we still, when we quiz them after the fact, we're getting, not the answers that we're looking for. And don't make the quiz easy. Don't make it so that it's simple to pass without taking the knowledge. They need to actually have some questions within that quiz that shows that they paid attention to the specific item that you're trying to train them on. So I would probably take a look at some of the standards organizations that are out there. If you don't have access to anything like that, take a look at just 29 CFR 1910 or 1926, which is the OSHA code that's out there. And you can at least start there with compliance. But then you have to take a look at your own organizational goal. Where do you want to go from there beyond compliance? and make your goals at that point. All right, where are our gaps at now?
Well, thank you, everyone. This ends today's Safety and Health Magazine webcast. I'd like to thank our awesome presenter, Zach Pacello, the entire team from our sponsor, KPA, and of course, all of you who listened in. Take care and have a safe day.